Salmonella. First one is the classification and nomenclature. So Salmonella is antigenically complex. It can be classified into two based on clinical classification, typhoidal and non-typhoidal groups. First one is the typhoidal Salmonella. The example of typhoidal Salmonella is Salmonella typhi and Salmonella paratyphi. It is restricted to human host and it will cause enteric fever. Next one is the non-typhoidal Salmonella. The remaining of serotypes will colonize the intestine of a broad range of animals and it will cause foodborne gastroenteritis and septicemia in man. Next one is the antigenic classification. It is otherwise known as Kaufman-White scheme. It is based on somatic O antigen and F lagular H antigen, which is detected by agglutination with antisera. Next one is the serogroups. Based on O antigen, Salmonella is classified into 67 serogroups. Serogroup 2 in this Salmonella paratyphi A, it contains O antigen type 2. Serogroup 4, Salmonella paratyphi B, it contains O antigen type 4. And serogroup 9, Salmonella typhi, it contains O and antigen type 9. Next one is the serotypes. Each serogroup is further, it is typed into 2500 serotypes based on flagellar antigen. Next one is the molecular classification. According to molecular classification, Salmonella is consist of two species. One is Salmonella enterica and the other one is the Salmonella bongori. Most of the pathogenic serotypes are placed under subspecies Salmonella enterica. The nomenclature of Salmonella typhi is Salmonella species enterica. Next one is the antigenic structure. Salmonella will possess three important antigen: somatic antigen O, flagellar antigen. It is present in all serotype or other species, and surface envelope antigen. It is found in serotype or species. Next one is the differentiation between O and H antigen. O antigen is otherwise known as somatic antigen. It is a part of cell wall lipopolysaccharide. O antigen is heat stable, alcohol stable, but formaldehyde labile. In viral test, O antigen of Salmonella typhi is used. O antigen is less immunogenic, and O antigen antibody in O antigen antibody appears early and disappears early, which will indicate recent infection. When O antigen react with O antibody, it will form a granular, chalky, clump-like appearance in which the agglutination will take place very slowly in O antigen. The optimum temperature for agglutination is 55 degrees Celsius. Serogrouping is based on the O antigen. The H antigen is otherwise known as flagellar antigen. It is made up of proteins, flagellin, and it will converse motility. Formaldehyde is stable, but it is heat labile and alcohol labile in H antigen. In viral tests, H antigen of Salmonella typhi, Salmonella paratyphi A and B are used. H antigen, it is more immunogenic. H antibody will appear late and it will disappear late. It indicates convalescent stage. When H antigen reacts with H antibody, it will form large, loose, fluffy clumps. Agglutination will take place rapidly. In H antigen, optimum temperature for agglutination is 37 degrees Celsius. Serogroups are differentiated into serotypes based on H antigen. Next one is the virulence antigen. It is a surface polysaccharide envelope or capsular antigen which it will cover the O antigen. The naming is due to belief that it is related to virulence. It is expressed only in few serotypes such as Salmonella typhi, Salmonella paratyphi, Salmonella dublin, and some strains of Citrobacter ferindae. When virulence factor antigen is present, it will render to bacilli inagglutinable with the O antiserum. Virulence antigen is purely immunogenic and antibody titer is very low. It is not helpful for the diagnosis. so it is not employed in the viral test. However, it will complete the absence of virulence antibody in a proven case of typhoid fever. It will indicate the poor prognosis. Virulence antibody, usually it will disappears early in convalescence cases, but if persists, it will indicate the development of carrier state. Phage typing of Salmonella typhi can be done by using virulence antigen specific bacteriophages. Virulence antigen can be used for vaccination. Next one is the pathogenesis. Mostly it is transmitted by oral route, most common through contaminated food or water. The infective dose of Salmonella typhi is minimum 10 power 3 to 10 power 6 bacilli are needed to initiate the infection. The risk factors are mostly stomach acidity of age less than 1 year of age, antacid ingestion or achlocryhydria. Another one symptoms is the intestinal integrity, in which inflammatory bowel disease and GIT surgery or due to antibiotics are the risk factors. Next one is the Salmonella. Mainly it will enter through epithelial cells lining the intestinal mucosa. After entering, the bacilli will remain inside the vacuoles in the cytoplasm. Next, it will enter into macrophages. Salmonella that contains vacuoles, it will cross the epithelial layer. From there, it will reach the submucosa that is carried out by macrophage through bloodstream. Next one is the primary bacteremia will occur and then it will spread to other organs such as liver, spleen, lymph node and bone marrow. And massive secondary bacteremia will occur from cedar organs, which leads to onset of clinical disease. Next one is the clinical manifestations of enteric fever or salmonella. So the incubation period of salmonella is 10 to 14 days. Enteric fever is misnomer. The manifestations are most commonly extraintestinal than intestinal. Various manifestations such as mainly the important clinical manifestation is fever, step-laden pattern type of prolonged continuous fever is there. Other symptoms are headache, chills, cough, sweating, muscle pain and joint pain is seen. Rashes, which is called as rose spots, which is seen in 30% of patients. It will appear at the end of the first week of infection. And early intestinal manifestations such as abdominal pain, nausea, vomiting, and anorexia will be there in Salmonella infection. Late intestinal manifestations such as gastrointestinal bleeding, intestinal perforation will occur after 3 to 4 weeks. Some important signs such as hepatosplenomegaly, epistaxis, and relative bradycardia will be there. And neurological manifestation will occur very rarely, mainly meningitis, cerebellar ataxia, and neuropsychiatric symptom, which is described as muttering, delirium, or coma vigil, such as paranoid psychosis and delirium will occur. Next one is the epidemiology. Main important cause for the salmonella is human. The incidence is higher. The locality and age of endemic fever is more common in urban than rural areas. More commonly, the salmonella will affect the young children and adolescent than the adult. The most important risk factor for transmission of salmonella is due to poor sanitation and lack of access to clean drinking water. Salmonella typhi to Salmonella paratyphi A ratio is 4:1. Salmonella paratyphi A, it appears to be increasing mainly in India. It is due to increased vaccination for Salmonella typhi. Carriage is up to 10% of untreated patients become carriers. Carriers of rough two types. One is fecal carriers, it is the most common, and the other one is the urinary carriers. In fecal carriers, it will multiply in the gallbladder and they are excreted in fecus. In urinary carriers, multiplication will take place in kidney and the bacilli will excreted in urine. Next one is the duration of shedding. Carriers will continue to shed bacilli in fecus and urine. For convalescent carriers, it will takes about 3 weeks to 3 months. For temporary carriers, it will take 3 months to 1 year. For chronic carriers, it will take far more than 1 year. In chronic carrier, it occurs in about 1 to 4% of infected people. It is more common in women, infants, and old age, in which the biliary tract abnormalities will occur that will lead to increased fecal excretion, abnormalities of urinary tract, and associated cystosoma hematobium infection of bladder that will lead to increased urinary excretion. Next one is the laboratory diagnosis of enteric fever. For the first week, culture of blood, bone marrow aspirate, duodenal aspirate is done. Blood culture is the most important ideal method for diagnosis in the first week of fever. In 90% of cases, it will show positive results. Clot culture has shown higher isolation than blood culture. If the blood culture is negative, then bone marrow aspirate culture is done. If negative, then duodenal aspirate culture is done. Best combination, all the three specimens should be done. If the patient is on antibiotics, bone marrow aspiration is cultured than preferring blood culture. There are two types of medium is used. One is monophasic medium and the other one is Cassanet's biphasic medium. In monophasic medium, it contains brain heart infusion broth. In Castanet's biphasic medium, it consists of brain heart infusion agar slope and brain heart infusion broth. In second and third week, antibody detection by viral test is the investigation of choice for the enteric fever, in which the stool culture is preferred if the patient is taking antibiotics. Enrichment broth such as selenite F broth, tetrathionate broth, and gram-negative broth is used. Some selective media are used in second and third week, such as low selective media, McConkey agar. And in the fourth week, stool and urine culture is done, and carrier stool and urine culture is done. Serum for detection of antibodies to virulence antigen, and sewage culture is done in indirect way for the diagnosis of enteric fever. Next one is the viral test. In the second and third week, viral test is the investigation of choice. Antibodies will appear only after the end of the first week, so it is not preferred in the first week of illness. Principle, it is an agglutination test where H&O antibodies are detected in patient sera by using H&O antigen. Antigens used, 4 antigens are totally used. O antigens of Salmonella typhi, H antigens of Salmonella typhi, AH antigen and BH antigens and paratyphoid O antigen are not used because they will cross react with Salmonella typhi O antigen due to sharing factors number 12. Next, strains used for antigen preparation. Salmonella typhi 900 and O antigen and H strains, and lab strains for Salmonella paratyphi A and B. Next one is the result. O agglutination will appear as compact, granular, chalky clumps, disc-like pattern. It will appear with clear supernatant fluid. H agglutination appear as large, loose, fluffy cotton woolly clumps with clear supernatant fluid. If agglutination will not occur, button formation will occur due to deposition of antigen, and supernatant fluid will remain hazy. Antibody titri, highest dilution of sero at which the agglutination will occur. False positive viral test may occur due to anamnestic response. It means it refers to transition rise of titri due to unrelated infections such as malaria and dengue. False positive will occur in persons who had prior infection or immunization. If bacterial antigen suspensions are not free from fimbriae, false positive will occur. Persons with inapparent infection or prior immunization, the false positive viral test will occur. Fourfold rise in antibody titri in paired sera at 1 week interval is more meaningful than a single high titri. After 1 week, if the titri rises means it will indicate the true infection. If the titri it falls means it will indicate the anamnestic responses. Next one is the false negative viral test may occur in the early stage mainly in the first week of illness, it will show negative. In late stage, after fourth week and in carriers, it will show negative. Patients who are taking antibiotics, it will show negative due to proson phenomena, antibody excess. This can be abbreviated by serial dilution of sera. Next one is a viral test result. Rise of TO and TH antibody suggestive of endemic fever due to Salmonella typhi. Rise of TO and AH antibody. It is suggestive for endemic fever due to Salmonella paratyphi A. Rise of TO and BH antibody suggestive for endemic fever due to Salmonella paratyphi B. Rise of only TO antibody, it is suggestive for recent infection due to any serotype Salmonella typhi or Salmonella paratyphi A or B. Rise of only TH antibody, it is suggestive for convalescent stage or anamnestic response. Rise of all the three antibodies, it is suggestive for post-TAB vaccination. Next one is the vaccines for typhoidal fever, parental TAB vaccine. It is a heat-killed whole cell typhoid or paratyphoid A vaccine, and B. It is no longer in use due to its side effects. Next one is a parental virulence factor polysaccharide vaccine. It is composed of virulence capsule polysaccharide antigen. So it is derived from Salmonella typhi strain TY2. Dosage single dose containing 25 mg of virulence antigen is given. Mainly it is given intramuscularly or intrasubcutaneously. Vaccine will confer only for protection for about 2 years. Virulence antigen, it will elicit T-independent immunoglobulin G antibody and booster dose is given at 2 years. It is mainly given only after 2 years of age. Next one is a typhoral oral live attenuated Salmonella typhi vaccine. It is a stable live attenuated mutant of Salmonella typhi strain TY21A. It lacks the enzyme galactose 4 epimerase. On ingestion, it will multiply for some time. After few hours, it will initiate the immune response, but it will self-destruct and dies of its own after 4 to 5 cell division due to lack of enzyme. So it will not induce any pathogenesis. This typhoral vaccine is mainly indicated after 6 years of age. Lipolyzed form of vaccine is available as enteric coated capsule. It is given orally before food or on alternate days 1, 3, 5, and 7. Totally 3 or 4 doses is given. No antibiotic should be given during this period. Next, protective immunity will start after 7 days of last dose and it will last only for 4 years. Boosters are recommended for every 3 years in endemic area and every year for travelers. Next one is the difference between non-typhoidal salmonella and typhoidal salmonella characteristics. In non-typhoidal salmonella, it is zoonotic. In typhoidal salmonella, it is mainly strictly human pathogens. In non-typhoidal salmonella, the transmission is mainly due to animal food products. The resistance is relatively resistant to many environmental factors such as drying, salting, smoking, and freezing. The prevalence is mainly in developing countries. Hospital outbreaks are common. Pathogenesis is similar to endemic fever, except neutrophil infiltration occurs into intestinal mucosa. In the clinical manifestation of non-typhoidal salmonella is gastroenteritis will occur. Bacteremia is common in Salmonella chloriaceus and Salmonella dublin species. An endovascular infection such as endocarditis will occur in non-typhoidal salmonella. Metastatic localized infection will occur mainly in the intra-abdominal infections such as hepatic or splenic abscess, and inflammation of gallbladder will occur. Salmonella osteomyelitis is commonly associated with sickle cell disease, and reactive arthritis is seen in persons with HLA-B27 histocompatibility antigen. Drug resistant, it is more drug resistant. Next one is the typhoidal salmonella. It is mainly strictly human pathogens. The transmission is mainly through waterborne. It is less resistant. The prevalence is seen mainly in the developing countries. In typhoidal salmonella, the hospital outbreaks is very rare. The pathogenesis of typhoidal salmonella is mononuclear cells infiltration in intestinal mucosa will occur. The clinical manifestations is it will cause endemic fever, and drug resistant is it is less drug resistant.